Hi, thanks very much for inviting me. My name is Renée Adams. I'm a professor at finance at Said Business School, University of Oxford. And my research area is supposed to be finance, but I do a lot of unconventional work for a finance academic. So I do a lot of work on gender, on boards, but also recently in the art world is something I've been interested in. Yeah, so the starting point of the paper is this argument that to change outcomes for women and minorities, we could change board diversity. And so implicit in this argument is the idea that the minorities, once they reach the board, are going to enact change. And so what our paper shows is actually there may be cost to advocacy for minority directors on the board. So minority directors don't speak up about diversity in the boardroom, and female directors also don't speak so much about diversity. And if you don't speak about diversity, you can't enact change, is our argument. And so the point is that a demographic diversity is not necessarily going to automatically lead to more equality if you don't also have the empowerment that directors need in order to enact change. Yes, so the NHS, which is the National Health Service in the UK, is obviously really important for the UK, but it's also one of the largest employers in the world. And they constantly struggle with diversity issues, so there's always lots of news reports around diversity issues in the NHS. So it's a good setting to see whether directors actually address diversity issues. Because there are diversity issues that need addressing. But also what makes our data unique is we have minutes of board meetings which are required, the NHS is required to disclose the minutes to the public. And so this is sort of like a very unique setting where we can study in depth what directors are saying in the board meetings. So I guess a lot of my interpretation of the results comes from my personal experience. So I think there could be costs to women and minorities for speaking about diversity issues, which a lot of people don't view as being part of a director's job. I mean, as a director, you're supposed to do the director's job. And if you start speaking about diversity issues, people may say that you're not professional, or there may be backlash. And so it can actually be very costly to talk about these issues, especially if you're underrepresented. So what I mean by that is people may discredit you. They may think that you're not actually very qualified because you're talking about diversity issues, which is not necessarily part of the core function of the board. Or there may be backlash. So raising issues around diversity, which may potentially also relate to harassment and bullying, that may make people uncomfortable, and people don't like being challenged. And so that can have sort of career consequences for directors if they raise these issues. I think it's a sensitive topic for women and minorities to bring these issues to the table. Because people don't like talking about them. So it's a very uncomfortable topic for many people. Yeah, I think the thing that mostly surprised us is, well, we don't really find very strong effects for the women and the minorities that they talk about diversity. So in some sense, it's the opposite of what many people say. We think the cost of advocacy help explain it. But the really interesting finding was that the HR director plays a really important role. So the HR director talks much more about diversity than other people on the board, which is sort of, in some sense, it's obvious because that's their job. But it also shows that having authority to talk about these issues really matters. I think they have to start recognizing that there may be costs to advocacy. So it's not as simple as just changing representation, right? So you also have to change the empowerment that directors feel to address these issues. And we find some evidence that regulation around disclosure, for example, around the gender pay gap, that seems to create space for more discussions on these topics. And so that's an interesting finding that I think could have more general implications. So thinking about how do you empower people to actually talk about these issues. Yeah, I think when it comes to quotas, you always have to ask effective for what? So they are effective in changing representation, but whether they actually achieve other goals is, I think, a bigger question that often people don't ask. So in the EU context, they say, for example, that changing representation on boards will lead to better outcomes for women. But then the question is, well, how are these better outcomes for women going to happen if our paper basically suggests that it may be hard for women, once they're on the board, to talk about these issues and to advocate for these issues. So it's not totally clear, if they're not empowered to take action, how these spillover effects will happen. So the quotas are effective at changing representation. Are they effective at changing other potential goals? It's not so clear. Yeah, I think this is an area where much more research needs to be done. I mean, I think it'll be interesting to see what happens, because one of the main findings of our paper is that having authority to talk about these issues is really important. And if you take away this authority by cutting DEI initiatives, if you no longer have DEI on the table as a topic for discussion, it could be that other directors start talking more about these things, if there's no HR director on the board anymore, for example, or people just may not address these problems, which would be, I think, a really big problem to the detriment of society. So I think we don't know yet, but it'll be interesting to see what happens.